Hi, my name is Gina Hogg. I work in inpatient geriatric medicine at a large medical center, and I work closely with the surgery, trauma, and burn teams. So nutrition plays a big part of the recovery of a lot of the patients that I see on a day-to-day basis. A lot of these patients have a very long, difficult road ahead of them as far as their recovery goes, and they're over the age of 65. They come from a variety of different backgrounds, whether it's socioeconomic, their education level, or their access to health care. So it's very important, I feel, to provide them good education while they're in the hospital to help them understand the role nutrition plays in their recovery. Oftentimes, food can be a challenge when they get home, so we try to provide solid examples of good nutrition or supplementation they can do to help as they recover. Our team spends a great deal of time doing this just to try to optimize them for the best possible outcome. And we want them to make choices that are going to help them recover and not have to return to the hospital. One excellent example of this was a patient that I treated, and I'll call her Mrs. Smith. Mrs. Smith was a very pleasant lady who was rather large. She was an obese patient who had a large ventral wall hernia. And she came in about a year and a half ago with a small bowel obstruction, and they were unable to perform surgery on her because surgeons felt that it wouldn't be successful due to her weight, that the hernia would likely reoccur. So I spent a great deal of time talking with her and realized a couple of things. She had untreated depression, largely in part because of the health problems that she had. And I also spent a good amount of time addressing nutrition with her and trying to identify the things that she was doing at home and what I could do to help her in her weight loss goal, because she really did want to be successful. This large hernia was a source of great embarrassment to her, and she wanted to have the surgery. She wanted to feel like she could have her life back. I was very pleased 4 months ago she was able to come back in the hospital and have a successful surgery, and she was much happier and healthier because of it. So my takeaway with regard to nutrition is to be your patient's cheerleader, to try to understand if they seem to be lacking motivation, what's causing that, and what you can do to help, and what kind of motivation you can provide, or possibly even treat an undiagnosed thing like depression that might be holding them back. Just realize that oftentimes they do want to do what's right, and they do want to get better, and you're helping to be their cheerleader and help them along can go a long way towards helping them to get better.